Hey there, Dr. Jim, and I have a heavier, darker topic for you. I know many portray me as the joyful gerontologist, and I am very joyful, very happy, very blessed about so much. But there is an issue happening among older adults and seniors. Sometimes it's lurking in the shadows, sometimes it's right under our noses. And it's what my topic is on today: self harm in older adults. Hard to talk about, but I think we have to. Self harm among older adults and seniors appears to be a growing problem, affecting not only the individual who harms him or herself, but families, friends, communities, and society as a whole. A number of factors contribute to this trend, including physical and mental health problems, troubled relationships, loneliness, dementia, and financial stress. Despite many older adults being seen by a healthcare professional within a month before self harm occurs, more needs to be done to reduce or prevent this destructive trend and this destructive behavior. So, in order to understand self harm in older adults, let's clearly define what we're talking about. What is self harm? Although there are a number of ways to define this, self harm generally means the act of injuring or poisoning oneself regardless of motivation or intention, and does not include purposeful neglect like refusing to eat or drink. Self harm, according to many experts, is highly associated with suicide. That's why it's important to talk about this, and mental health problems later in life. Of an important note, self harm is a major risk factor for suicidal attempts and completions, and that's why this needs more attention. So, self harm in older adults. Why? What's causing it? Here are some influencing factors to think about, look for, associated with self harm. By far, and this is based on research, the most common factors associated with self harm among both older men and women are a history of self harm behaviors and a previous or current psychiatric diagnosis, particularly a diagnosis of depression. And I would think major depressive disorder would be the exact diagnosis. Substance use or abuse is also closely related to the act of self-harm. In fact, in many cases, drugs are used, alcohol is used before, during, engaging in self-harm behaviors. But there are other factors to look for as well. For instance, co-occurring physical health problems like chronic pain, arthritis, dementia, cancer, or a terminal illness. Mental health conditions like depression, schizophrenia, or bipolar disorder. Relationship problems, social isolation, and loneliness can all contribute to self-harm. The loss of a loved one, a traumatic loss, prolonged grief, or bereavement. And sometimes when something terrible happens, and then a month or two later, another major loss occurs, that individual doesn't have enough time to process grief and go through the bereavement process. So they end up experiencing what experts call complex grief. Perceived burden to families or caregivers, a lack of social support, problems with mobility or freely getting around. Any of these, all of these can contribute to an adult thinking about self-harm or suicide. Now, in order to understand self-harm in older adults, we have to look at methods. Methods of self-harm. What are they doing? What are they using to harm themselves? According to research, overdose. Overdose is the most commonly used method of self-harm among both older men and women. Although women have a higher risk for this and involve the use of over-the-counter medications, antidepressants, benzodiazepines, and sleep medications. Older adult men and women also use cutting. And I've done a lot of research on cutting, but it was years ago. And what I discovered was individuals who cut may have bipolar disorder, may have borderline disorder, so on and so forth. And cutting now, according to the latest version of the DSM, is non-intentional suicidal behaviors or something like that. So they don't want to die of suicide, but they're cutting to harm themselves to relieve or release emotions and pain. We used to think it was something that younger people did, but now we know that older adults do it as well. Hanging is another one. And of course, I think of Robin Williams, sadly enough, when I think of something like this. But other methods of self-harm do include hanging, use of firearms, car fumes, jumping from tall buildings or places, jumping in front of moving vehicles, and immolation, setting oneself on fire. This is sad. I told you this was sad and dark stuff, but it's on the rise, and it is highly associated with suicide, so we do have to pay attention to this and do something about it. Some older adults will also use more than one method of self-harm, such as a combination of alcohol, prescription drugs, and a gun. Just like in the younger population, males use more lethal means of self-harm, like using a gun, and females will use pills and other substances. I think the most important thing we need to discuss about self-harm among older adults is prevention and intervention, because self-harm is such a multifactorial issue and involves many risk factors and methods. It demands a very comprehensive, multidisciplinary approach to reduce or prevent it altogether. Many older adults who self-harm visit their healthcare practitioner just weeks prior to the act, and it goes almost unnoticed. So it's crucial for physicians, nurses, nurse practitioners, case managers, and social workers to know their patient thoroughly as a human being and to know everything within their lives and conduct thorough assessments taking into account the patient's current problems, their mental state, physical health, risk factors, and if that patient has the means of support from any friends or family members. And very importantly, the healthcare team needs to follow up with their patients in a timely manner. Maybe a phone call 2 to 4 weeks later after that appointment if you're suspicious. So when it comes to self-harm and older adults, I do have some final thoughts after reading through the research, the most recent research. Even more so than younger people, older adults and seniors engage in self-harm behaviors that at times may lead to suicidal attempts and, unfortunately, completion of suicide. Many factors can influence the older adult to harm oneself in a number of non-lethal ways. Depression and substance use are leading factors in self-harm, and it's vital for healthcare professionals to follow their patients, understand their situation, and provide the help they need, and then follow up on a routine basis in efforts to reduce or eliminate such harmful and life-threatening behaviors. So there I had it. There I have it. A dark topic, but a necessary topic. Self-harm in older adults. I'm Dr. Jim. Please keep coming back for more information. I really do value you and the time that you take to watch my videos or read my articles on my blog, drjimcollins.com. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.